Welcome, friends. This is Dr. Sharad Jaitly from New York. Welcome to MuniMeterHealth.com, your favorite website, which is dedicated to teach heart and its illnesses, not only to my medical fraternity, but also to the general masses. So welcome again to MuniMeterHealth.com, our favorite website that you've shown a great association and dedication to. I appreciate your support and your enthusiastic interest. Without any further ado, let's delve into the facts of, well, today's subject is going to be how do you make an interpretation of a stress test and then make a decision. So clinical decision making of a stress test shall be discussed on this video. Clinical decision making of a stress test, cardiac stress test, okay? So that'll be our interest today. So how do we approach that now? Well, one of the ways that you can clearly say is that having seen the previous video, I'm sure some of you have already done it, but once we ascertain that the test is negative, that means there is no evidence of ischemia in a fully maximized stress test, which is done under adequate controlled environment. And we know that it's negative by ST changes, it's negative by symptoms, negative by heart rate or blood pressure response, totally normal stress test. You have literally almost excluded coronary artery disease in that individual. So the likelihood of finding coronary artery disease is extremely low based on that adequate test. So obviously the patient had chest pain before or was referred based on that chest pain episode or whatever symptoms. So then you have to worry about what are the other causes of chest pain the person may have. Well, it could be cardiac, but it could be mitral valve prolapse. It could be other reasons like costochondritis, as we call it, costochondral inflammation, so costochondritis. It could be musculoskeletal for other reasons. It could be from the breast tissue in a female. It could be, hepatic inflammations or neuritis, etc., neuralgia that's happening there over the chest regions, or it could be from lung. So you have, and do not forget the GI causes, and then the lung causes. So there are, these are various testings that you'll start to resort to and work up these patients accordingly and decipher at that point what that chest pain is from, because you have excluded the possibility of ischemia or coronary artery disease in that individual, then you have to worry about what the symptoms were from originally. So unless the symptoms subside and they are self-limiting by itself. But then these are some of the causes that I just said. So now having seen that, let's delve on the fact that what if the stress test is positive? Now, positive we have already defined, that's more than 1 millimeter in 2 consecutive leads makes it a positive stress test. So having ascertained that, now let's understand what if it is weakly positive stress test, and what if it is moderately positive stress test, and what if it is severely or significantly or strongly positive stress test. So these are just arbitrary mild, moderate, and strongly positive stress testing signs or symbols we use. So, but in general, now when you say a mildly positive stress test, and all three, they will connote that there is some ischemia present. So there's mild ischemia present, there's moderate ischemia present, and there's severe or strongly multiple areas where ischemia is present based on a regular stress test. Now, small amount of ischemia when it's present normally can be managed medically, and you can start with nitrates first, preferably a nitroglycerin sublingual, and then gradually increasing to longer acting versions of nitrates, longer acting. And then, try to manage with the small doses of beta blockers may be necessary, specifically if the patient has other cardiovascular risk factors, and the risk factors could be anything from hypertension, you could have diabetes, you could have high cholesterol, and you could have family genes. Of course, these are non-modifiable risk factors. You can't change your genes now, but family history, obviously, you can work those patients and the siblings specifically because they are higher risk, they could be worked up as well. So that's the recommendation by ACC. And then you have, obesity and lifestyle modifications like patients are smokers, etc. So you could concentrate on those aspects of care, like offering starting with nitrates, nitroglycerin sublingual first, and then going on to longer acting versions of nitrates, and see that chest pain is minimized, and continue to follow these patients on 2 to 3 monthly intervals. So this way you can regulate these medications rather more closely. Beta blockers, a low dose would be helpful, especially to keep the heart rate closer to 60 or 70, especially in individuals, and try to rule out other possibilities of any other reasons why the heart rate is high, like thyrotoxicosis or hyperthyroidism, etc., etc. Now, calcium blockers could be used as well in this setting. Why? Because the beta blockers, you don't want to maximize to cause any side effects, so you can use low dose beta blockers or medium dose beta blockers and combine that with a small dose calcium blocker to control the hypertension in a little better setting. You could use ACEs and ARBs here primarily because those groups of drugs are very helpful in a setting of hypertension and diabetes as well. Now, you may run into trouble with beta blockers, specifically if you have an asthma or a patient has COPD or has been a chronic smoker, so therefore calcium blockers then again would be a very good choice here. So having addressed those facts in a mildly positive stress test, let's move on to moderately positive stress test. A moderately positive stress test usually implies that there is at least a 2 millimeter or more of ST segment depression. You have possibly about 2 segments on a nuclear stress test involved, or sometimes you may see that even on an EKG you'll see a V5, V6 ST segment depression, and or one more area perhaps, maybe AVL. May be involved. That means suggesting a high lateral ischemia. Or it could be involving 2, 3, and AVF, and then also V5, V6. So that suggests that there are 2 areas which may be involved. It could be a moderately positive stress test. You can still try to control the symptoms here with the medical therapy, if you will. A strongly positive stress test normally implies an early positive stress test. That means the person has walked less than 6 minutes. So just make sure that the duration is right here. A patient, if has not even had a chance to complete the stage 2 of the Bruce protocol and is showing profound ST segment changes, that is a strongly positive stress test, mind you. More than 3 millimeters, so normally 3 to 5 millimeters could be a good description of that. Moderate to severely positive stress test here in this individual, and here showing multiple segments involvement. Say you could have an enterolateral involvement where it could be from V1 to V6 ST segment depressions, or you could have infralateral like 2, 3F and then V5, V6, or it could be high lateral, for instance, 1 AVL and V5, V6 could be involved. So multiple segments involvement, early positivity of the test, and then of course strong ST segment depressions like with a high magnitude of 3 to 5 millimeters, and above all taking longer time to recover. Now, patients after they sit down on the treadmill, after they walk off the treadmill, next thing is they are being monitored in recovery. And when they're being monitored in recovery, it's taking too long, like 5, 10, 15 minutes for the ST segments to recover. And you use nitroglycerin to, obviously there's an intervention required like a nitroglycerin sublingually has to be given to reverse. That itself speaks of that the test is markedly positive. Now these patients automatically, they will go for angiogram, just so that you know. So they must have an angiogram the same day, within a couple of days, or definitely within a week. So they should be aggressively treated and aggressively monitored, if you will, possibly be admitted, within a day or the same day from the stress lab, and be monitored and arranged for an angiogram after speaking to the interventionist or the interventional cardiologist. They may require all these medications to be adjusted, like the oral agents for diabetics. Hypertension may have to be better adjusted with combination therapy, and high cholesterol, of course, if they have, a statin must be added here. And lifestyle modifications, of course, play a big role in all forms of positive stress tests, because again, smoking sign is off. No more smoking in these individuals. That's the highest risk factor you could expect. Second thing is immediate weight reduction has to begin in all these cases. And then, of course, diet. Specifically here in these 2 groups, the diet has to be low carb, low fat, low sugar, and low calorie diet here. Absolutely, because that's a given immediately. One has to really take that into account. Okay. Well, thank you for your attention. Here's the clinical decision making of cardiac stress tests that I just wanted to present to you and discuss with you in this short video on MuniMeterHealth.com. Thank you for watching and supporting MuniMeterHealth.com, and looking forward to talking to you in my next one. Until then, so long.